50-year-old man presents to the office with the complaint of fatigue, difficulty breathing, and for the past few weeks, he also complained early morning stiffness for his metatarsophalangeal and metacarpophalangeal on both sides, lasting for 2 hours, which feels better only with warm water tub bath every day in the morning. He denies any kind of rash on his body. He's been working in shipbuilding industry for 20 years. He loves skin tanning and hunting in the summers. He smokes 2 packs of cigarette every day, and he has been doing for past 15 years. The pulmonary test shows reduced force expiratory volume in 1 second to FVC ratio with reduction in FEV1 to FVC and decreased DLCO. His chest X-ray shows multiple nodules with calcification. Which of the antibodies most likely seen with this patient? Yes, so the patient here has anti-CCP or citrulated cyclic protein, the antibody against CCP. So let's go through what this patient might be having. This patient is classically having a syndrome that is called Kaplan syndrome. Kaplan syndrome is seen in patients who are working or having exposure to coal plus rheumatoid arthritis like symptoms. So this is the most common, the two things you have to remember is Kaplan syndrome is seen with exposure to coal or any occupation related hazards, and they present with rheumatoid arthritis like symptoms. So what are the rheumatoid arthritis like symptoms? You can see patient having fatigue due to anemia, difficulty breathing due to pleurisy or having pleural effusion, and patient having uh, symmetrical joint pain that lasts for 2 hours. This is a classic for rheumatoid arthritis, while osteoarthritis, the joint pain on the morning only lasts for 30 minutes, while in rheumatoid arthritis, it lasts for more than 1 hour. And patient denies any kind of rash, and he has been in shipping industry for past 20 years. So this can suggest us to have exposure to coal. He loves skin tanning and hunting in the summers. You can see the patient is having a restrictive type of disease where there is FEV1 to FVC ratio is both have been decreased, and there is a DLCO decrease in diffusing lemon, and the patient is having rheumatoid nodules in the lungs with a calcification. So this patient is classically having Kaplan syndrome with rheumatoid arthritis antibodies. So let's see what is a Kaplan syndrome. You can see Kaplan syndrome is pulmonary nodulosis in rheumatoid arthritis patient with pneumoconiosis related to exposure of coal dust, silica, or asbestos. So whenever there is a pulmonary nodulosis, like in this type of here, you can see pulmonary nodules here due to exposure to coal dust, silica, and asbestos. It's characterized by multiple 1 centimeter peripheral lung nodules, and the prevalence is 2 to 6% in rheumatoid arthritis patient, and there is spontaneous remission. What are the antibodies that are usually seen with certain diseases? We have to remember certain of them. You can see there is anti-IgG rheumatoid factor antibodies and anti-CCP that is seen with cyclic citrulated peptide that is seen with rheumatoid arthritis. You can see there are other antibodies we have to remember. The nucleic acid, Na double stranded DNA, and anti-Smith, that is seen with SLE. Antihistone is seen with drug-induced Sjögren syndrome, is seen with anti-SSA or RO or LA, anti-SSB, and anti-U1 RNP ribonuclear protein is seen with mixed connective tissue disease. Phospholipid is seen with anti-phospholipid antibody. Anti-smooth muscle is seen with hepatitis, chronic autoimmune hepatitis. Centromere is seen with CREST syndrome. You can remember C in the CREST for centromere. Anti-SCL70 is seen with diffuse scleroderma. Mitochondrial antibody is seen with primary biliary cirrhosis, while antithyroglobulin is seen with hypothyroidic condition like Hashimoto thyroiditis. Anti-Jo antibody is seen with, we just discussed, it's dermatomyositis with polymyositis. Anti-basement membrane is seen with good pasture, while antigliadin and endomysial and transglutinase is seen with celiac sprue. Others like ANCA are seen in vasculitis, and antiparietal cell or intrinsic factor we seen with gastric autoimmune chronic gastritis. Anti-glutamic acid decarboxylase is seen is type 1 diabetes. Okay, and this is we have to remember.
Thanks for watching. Please give a thumbs up and subscribe for more.